Good afternoon. I am Dr. Anuradha Khurana, consultant obstetrics gynae from Paras Bliss, New Delhi. Today, we are going to discuss about the epidural anesthesia, that is the painless delivery. To begin with, the lifestyle changes today are affecting women's health, and with women postponing motherhood till late 30s and conditions like obesity, hypertension, the chances of normal delivery have become very less. And with age, the threshold to bear pain also reduces. But epidural anesthesia increases the chances of having normal deliveries, as threshold to bear labor pain among women have reduced. They prefer to go for epidural anesthesia. So we are going to discuss about the painless delivery, the methodology of painless delivery, the advantages of the epidural anesthesia, what the doctors say about it, the myths and facts, and the important aspect, that is the antenatal care and massage therapy, and most important, the complications about it. To start with, all pregnant ladies who are at the verge of motherhood have one common fear, the fear of acute labor pain during the time of childbirth. The intensity of pain varies from one mother to another. Some have very less labor pains and the pregnancy is easy, while many others have long delayed labor pains. So, the women who have the fear of pain often offer cesarean section unnecessarily, even when they can deliver vaginally. But now the woman could not deliver without pain. This has been made possible by the epidural anesthesia, which suits those patients who are unable to tolerate the labor pains. This process is fully safe for the child and mother both. It is a common method preferred by women to combat pain during delivery. During this process, the pregnant lady remains conscious and aware of the activities going on, but there is numbness at the pelvic region. It is the combination of pain-killing medications. The medications which prevent the transmission of pain signals from the womb to the cervix to the brain. An epidural anesthetic blocks the nerve roots that leads to uterus and the lower part of the body. To start with, we should understand the stages of labor pains. There are three stages of labor, and the final one is actually the arrival of the baby with the delivering of the placenta and the membranes. The first stage, it is just the beginning of the labor where the cervix starts to open and the thinning and shortening of the cervix take place, and the position of the cervix also take place. In the second stage, it is actually when the mouth of the cervix, the mouth of the uterus cervix has completely taken place and the baby has come to the pelvic region. After that, the third stage comes when it is actually you need to push down and the baby comes out and there is delivering of the placenta with it. At this stage, you mainly need the epidural anesthesia. The epidural anesthesia is a regional anesthesia that blocks the pain in a particular region of the body. It blocks the nerve impulses from the lower spinal segments. This results in the decreased sensation in the lower half of the body. To begin with, first we give the intravenous fluids which are started actually before the active labor starts, and you may need 1 to 2 liters of IV fluid throughout the labor and delivery. An anesthesiologist, the obstetrician and the nurse will administer this epidural. There is a specific position to give the anesthesia which will be explained by the nurse and the anesthesiologist, and then they will induce a small tube or catheter threaded through the needle into the epidural space in the back. The needle is then carefully removed, leaving the catheter in place to provide medication through periodic injections or the continuous infusions. The catheter is taped back to prevent it from slipping out. What are the advantages of epidural anesthesia? This method provides almost complete relief of the labor pains in most of the cases. The patient is in conscious state during the delivery, more involved in the process and mobile. It just decreases the anxiety and the irritability caused by the labor pains and gives the confidence to the patient, as a result of which she is able to cooperate during labor and delivery is better and faster. It also makes it easier to carry out instrumental deliveries like forceps and during the stitching of the episiotomy. It also helps in dealing the exhaustion, irritability and fatigue during delivery. When in labor pain, the mother secretes hormone which may give distress to the baby. It brings down the high blood pressure which some of the mothers have during labor and comfort the mother as well as the baby. It is extremely beneficial for the patient who have heart disease. And even if the patient has to be taken for cesarean section, the effect can be topped up with the epidural anesthesia and no extra anesthesia need to be given for cesarean. This availability of the advanced method is beneficial for the patient, and it is most important when you can opt for the method or not. It depends on your medical history, and this will be decided by the doctor. The doctors usually recommend this method to those patients who have medical conditions such as complicated or prolonged labor, or in such circumstances, it will be beneficial to you and your baby, and trying for vaginal birth after cesarean section, or having certain medical conditions such as cardiac issues, hypertension, or preeclampsia. When you should not opt for this method. Those who have any kind of bleeding disorders or on any medication which affect the blood clotting, like heparin or warfarin, or you had earlier had ever lower back surgery or any sort of neurological disorders, they are recommended to refrain themselves from this type of technology. What are the myths and facts about this epidural anesthesia? The women who wish to go ahead with painless delivery often have some questions in their mind. There are several myths and facts related to epidural anesthesia. Some questions are like, does epidural affect the breastfeeding? No, it does not. Will I be able to push? Yes, it makes pushing more comfortable and easier. When will my epidural be placed? Typically, the epidural is placed when you are in active labor, or the cervix we say is 3 to 4 centimeter dilated. Is there any complication of this epidural anesthesia? Very rare and minor complications are there, which may be persistent positional headache, post-delivery, shivering, ringing in the ears, backache, soreness at the anesthetized area, nausea, or difficult urinating. In extremely very rare cases, there may be meningitis or but if the sterile precautions are taken, the same can be avoided. Is it costly? The differences of the charges in normal and painless labor is hardly 4,000 to 7,000 depending on the charges of hospitals. Does the placement of epidural anesthesia hurt? The answer depends on who you ask. Some women describe the epidural placement as creating a bit of discomfort in the back which was already numbed, and a feeling of pressure as a small tube or catheter is inserted. Okay, next, how can an epidural affect my baby? Not exactly. It does not affect the baby. Maybe sometimes when the baby in utero becomes lethargic or has trouble getting into the position for delivery. Some important aspects about epidural are to have a normal painless delivery. Some other alternative methods of other than epidural anesthesia are also very important and play a massive role in making a normal vaginal delivery manageable. Some of them are the Lamaze Technique, the Antenatal Care, and the massage therapy. In the Lamaze Technique, the goal is to increase a mother's confidence in her ability to give birth. These classes help pregnant women understand how to cope up with pain in ways that both facilitate labor, promote comfort, and introduce relaxation techniques and massage. The Lamaze classes prepare the woman for a safe, healthy birth by providing the most current evidence-based information about birth and simplifying the birthing process. As a part of your antenatal care, doctor also advise you to join antenatal classes, which help you and your partner to prepare for the labor, the birth, and parenthood. It focuses on labor birth and guide through your pregnancy. These classes include mainly yoga and breathing relaxation sessions by experts that help you to strengthen your pelvic region and prepare you for the labor birth. Thus, the massage therapy, a pregnancy massage, is a pre-delivery and post-delivery specialized treatment that aims at massaging the stress points, relieving pain and anxiety. The massage therapy relieves the mother of the normal discomfort such as stiffness in the back, neck, the leg crampings, swelling and headaches, relaxing the weight-bearing joints and improving the blood circulation. The most common massage therapy used are aromatherapy and reflexology. To end with advancing technology, the mothers have an option of an easy method of delivery along with being fully cooperative participant in the delivery. The method is totally safe for the mother as well as for the baby. Each mother is educated on advantages and risks related to this technique by the doctor before she decides to opt for it. Such epidural deliveries have seen a rising trend in the last 2-3 years. since the charges are affordable for the amount of relief they provide from the unbearing labor pains. Even so, there is a lack of awareness concerning this procedure in India. The need of the hour is for the people to understand its benefits and utilize the benefits so that the experience of motherhood remains pleasant all around. Thank you.